All right, good afternoon, everybody. Today is Tuesday, December 8th. Hope everybody's having a great day. All right, today what we're going to be doing is we're going to go back to the bones again. And what we're going to do is we are going to basically put the muscles on the bones. So we're going to go to each bone and tell you which muscles are on that bone, whether they are origins and insertions. Tomorrow we will be doing innervations of the muscles. So we're going to group the nerves that innervate the muscles. And finally, on Thursday, what we're going to do is we're going to group the movements of the muscles. For example, what are the muscles that perform shoulder flexion? So we'll do it from basically the head all the way down to the foot. And we'll group them together like that. And then next week will be the last week of the reviews. We will actually jump back, go over all the bones, go over all the muscles, and what you'll be needing for the practical. So let's begin. Let me bring up the PowerPoint for the bones. Give me 1 second. All right, so like I said, what we're going to do is basically we're going to go over each of the the bones and which muscles that you will be responsible for and how they relate to the bones themselves. So give me 1 second here. Let me see if I can enlarge this screen. Put the slideshow on. I like the slideshow. It's larger. My apologies. Technology has its pluses and minuses. Let me try one more time. There we go. All righty. All right. So let me jump back. So here's the skeletal system. Again, the bones are the basis of the body. We have an appendicular skeletal system, and we have the peripheral skeletal system. The appendicular is in the tan, the peripheral is in the green, and we'll hit each of them. The axial skeleton forms the supporting axis of the body, while the appendicular skeleton includes the bones of the upper and lower limbs and the pectoral girdle. Again, we start out with approximately 300 bones at birth, but they start to fuse together and we end up with 206. Something that I do want you to know is I do want you to know what sesamoid bones are. We spoke about 2 of them. We spoke about in the wrist at the piriformis. I'm sorry, piriformis. The oh my God, word finding problem. Well, we'll hit that bone. The patella is a sesamoid bone, which is basically a bone that forms in the tendon. Okay, and the pisiform bone in the wrist is the other one. I apologize for having a moment. So the pisiform and the patella are 2 sesamoid bones that are within muscular tendons. Again, we're talking about the axial skeleton, which is the structural base of the body. The muscles all attached to the bones. And the appendicular skeleton, which is in the green. This is the parts of the body that moves, the scapula, the arms, the legs. So the axial skeleton is more for a base structure that we were basically work off of. The cranial fossa within the skull is the area where the brain sits. This will be something that you will not have to worry about. The frontal bone is one of the bones that you will be responsible for on the bone practical. Basically, it forms the forehead and part of the roof of the cranium. No muscles that we need will attach to this bone. The parietal bone forms the roof of the skull. It's part of the lateral walls. As you can see here on the bottom, it is the bony area here in pink. Let me pull out my pencil here, if it ever decides to work. There it is. It's this pink area here, both sides, the left side here and the right side parietal bones. And it's split up in the middle by this suture line. The ones in the pink are the parietal bones, and you are responsible for that on your bone competency. Temporal bone. The temporal bone, again, you will also be responsible for. The temporal bone has a couple of parts that you will need to know. It's basically this area in purple here, and it has a few little directions also. This whole area here is the temporal bone. Now, there's some parts of it that you will need to know that will be on the quiz, such as the zygomatic process, the external auditory meatus, the styloid process, and the mastoid process. Now, talking about the mastoid process is one of the bony structures that has a muscle that you will need to know. Remember, the sternocleidomastoid, the SCM, and it has mastoid in the name. So the sternocleidomastoid has its insertion on the mastoid process, is on the mastoid process. So sternocleidomastoid on the mastoid process is part of the temporal bone. The occipital bone is a bone that you will be required to know. Again, this is, sorry about that. It is the posterior portion of the skull, the rear or base of the skull. There's base, other than the area in green, which you will need to know here, this area here, the occiput or the occipital bone. Some of the structures that you'll need to know the name of this foramen. This is the foramen magnum, where the spinal cord goes through, going from the brain into the body. And the other part you will need to know is this bump in the posterior portion of the occipital bone. That is known as the external occipital protuberance. And there is an important muscle that does come from that area. The upper trapezius comes from the external occipital protuberance. The origin of the upper trapezius comes from the external occipital protuberance. So the upper trapezius muscle is the muscle that comes from the occipital bone, and specifically from the external occipital protuberance. Maxillary bone, you won't have to know. The zygomatic bone, again, you'll have to know the zygomatic arch. It'll be much more seen when you see the bones themselves. It looks like an arch. If you've ever been to Arches National Park, they have very long arches, and it's this area right here. It has a space on it. It's a bone that cuts across. It's basically your cheekbone. If you feel right here underneath your eyelid and then palpate backwards, that is the zygomatic arch. And it literally looks like an arch. The mandible, you will need to know that's here on the bottom. It is the strongest bone of the skull. It is the part of the skull that moves, and it's really the only bone that moves in the skull itself. There's no muscles that you're going to need to know from the mandible, but please understand the parts of the mandible that you will have to know. All right, you will have to know the body, and this is the body right here, this part. All right, from here to here is the body. This area, this curved area, is the angle. You will need to know that. The area above the angle is the ramus. There are two mandibular condyles. You will need to know the mandibular condyles. There are two coronoid processes right here and here. And you will need to know the mandibular notch here and here. And that mandibular notch is an area for nerves to pass through. So you will need to know the body of the mandible. You'll need to know the angle, the ramus, the mandibular condyle, right? Because it articulates with the mandible. The mandible articulates with the skull, the coronoid process, and the mandibular notch. Again, on your practical though, when I show this bone, all you will have to tell me is that it's the mandible. But on my exams and quizzes, the body, the angle, the ramus, the mandibular condyle, the mandibular notch, and the coronoid process are all open game to me. Okay, you've got to know those parts. So when we get you guys in here, I want you to go over all the parts of these bones. Hyoid, we won't be going over. Thankfully, that's the end of the skull. Remember about the vertebral column. We do have 33 vertebrae. I do want you to know for the exam the functions of the vertebral column. All right, they have some very important functions. All right, the vertebral column supports the skull. It allows for movement. It is basically the protective device for the spinal cord. The vertebra absorbs a great deal of stress when we walk, when we run, and when we lift objects. And it is a major attachment point for muscles, right? It is a major attachment point for muscles. And we will talk about some of the muscles that come off of the vertebra when we complete the vertebra itself in a few seconds. Again, I want you to, there are 33 vertebrae. Think of the vertebra as breakfast, lunch, and dinner. There are 7 cervical vertebrae that we have for breakfast. There are 12 thoracic vertebrae, and there are 5 lumbar vertebrae. Those are the main vertebrae. Remember, we have the sacrum. There are 5 sacral bones, and there are 4 coccygeal bones, which make up the 33 bones of the vertebral column. Remember, when we are babies, we really don't have all of those bones. They're kind of into one shape, and that shape is known as a child as the primary curve. The primary curve. And as you can see, there's not multiple curves like we have as we get older and as adults. And we get those curves from the ability to hold our head up and our ability to walk. And that's when the curves of the spine develop. As a baby, there's not a lot of weight bearing going on. That's why it's so important to have quote unquote tummy time. Tummy time is a key to a child's development and growth. We want our kids on their tummy, and that's a wonderful thing. So don't skip that time. If you have kids, put them on their tummy. They develop better. All right, they develop better. Again, these adult curves are created from our ability to walk and hold our head up. So we actually have different curves at different portions of our body. We have cervical curves, thoracic, lumbar, and pelvic curves. Now, as an adult, we do have primary curves. And the primary curves of the adult is at the thoracic and pelvic areas. As you can see, those two areas curve outwards. Here's the thoracic that curves outwards, and here's the pelvis, which curves outwards. The secondary curves develop inwards, and these cervical curves right here, as you can see, the curve goes inwards, and the lumbar curve, how it goes inwards, well, they develop cervical curves, like I said, develops when the child lifts their heads up and they begin to crawl. That's when those cervical curves begin to develop. Then as we grow older, we begin to stand, and walking upright develops our lumbar curves. So this could be definitely a question on my exam. How do those adult curves come into being? How does the cervical and lumbar curves occur? All right, so definitely could be a question. So please understand why and how these curves come into being. All right, especially those adult curves. The abnormal curves, I can also put this on my quizzes and exam. Basically, I want a definition. I would want you to define it. So a scoliosis is an abnormal lateral curvature. As you can see from the picture on the left-hand side here, all right, we have the spine here going straight down, but in the red, we have how the spine is actually curving here. Right there, that lateral curvature is known as a scoliosis. All right. So I won't ask you about concave and convex. That'll be for kinesiology. But I might ask, an abnormal lateral curvature is known as what? So an abnormal lateral curvature is known as a scoliosis. A kyphotic or kyphosis or hunchback is basically an exaggerated thoracic curve. Here in the middle, and this usually occurs in our elderly, it's usually, you'd see it as a hump, all right? You would see it as a hump in the thoracic area. So a kyphosis is a hunchback, is a hump in the thoracic area. What we also have is a lordotic curve. Now, in our backs, we have a normal lordotic curve, but here is a very excessive lordotic curve. A lordotic curve is a curve that occurs inward. A lordotic curve is an inward curve. Usually occurs in the lumbar area. We also have one in the thoracic area also. But as you can see here, here's a woman who's pregnant who has a great deal of weight in the anterior side. What's happening is, because all that weight is on the anterior, it's pulling the body, it's pulling structures in the back inwards. Hence, we have a lordotic or inward curve. A lordotic or inward curve. So please know the difference between a scoliosis, a kyphosis, and a lordotic curve. I need you to know the difference and the definitions of each of those. Again, the structure of the vertebra, you're definitely going to need to understand that. The body is that large center area. It's the primary area of weight bearing. The hole in the middle is known as the vertebral foramen, and that's basically where the spinal cord comes through. We have an area known as the vertebral arch. The vertebral arch is made up of two parts, the pedicle and the lamina. Now, the pedicle, which is this area right here, the pedicle goes from the body to the transverse process, and the lamina goes from the spinous process to the transverse process. And this whole area here is known as the vertebral arch. The vertebral arch. We have the spinous process, which is on the posterior side of the body. It's the part of the vertebra that you can palpate going down the spine. And we will go over some of the muscles that attach to these areas. I'll go through my sheet here. The transverse process is the area laterally. It's the two bones that extend out to the side. And again, this is an area of muscle attachment also. We have two areas. We have the articular processes. We have a superior and we have an inferior also that articulate with the bones above and below. And on these articular processes are facets, all right, which smooths the surface out to allow for movement of the vertebra. On the bottom, you see the intervertebral disc. We spoke about that. In the middle of the disc is something known as the nucleus pulposus. All right, the intervertebral disc is like a shock absorber. The nucleus pulposus is the gelatin-like substance area. And whenever you've heard of having a herniated disc, it is this area that herniates and gets busted. Going around the rest of the intervertebral disc is the annulus fibrosus. And those are concentric rings that basically protect the nucleus pulposus and tries to keep the nucleus pulposus in the center of the intervertebral disc. Erase, huh? Right, there we go. Now, remember we spoke about the vertebra. They have different characteristics. When I set up your practical, you're going to have a cervical vertebra, a thoracic, and a lumbar vertebra. And you're going to have to be able to tell the difference. I'm not going to ask you what number they are, but I will ask you at what level are these vertebrae? Are they cervical, are they thoracic, or are they lumbar? And again, there are certain characteristics that will guide you in your knowledge of these vertebrae. So let's talk about them. Let's first talk about the body of the vertebra. The lumbar body is the largest, all right? The lumbar body is the largest, okay, between the three. Here's the lumbar, here's the body of the lumbar vertebra. As you can see, it's larger than the thoracic, and the thoracic is larger than the cervical. So the cervical is the smallest. The lumbar is the largest. The spinous processes. Well, the spinous processes are also different. On the cervical vertebra, There are spinous processes that are bifid. It has two parts. The thoracic and lumbar vertebra does not have that. The thoracic vertebra, the spinous process is long and it's angled downwards. The cervical and lumbar vertebra are not. And the lumbar vertebra is thick but short. Thick but short. Where the cervical and the thoracic is definitely longer, and the cervical has those two bifid sections. Let's remember those transverse processes. Well, even the transverse processes are different. On the cervical vertebra, if you take a look here, here's the transverse process here and here. Well, there's a foramen in there, a transverse foramen that allows for the nerves and blood vessels to go up into the brain. The thoracic and lumbar transverse processes does not have that. The thoracic transverse processes has facets and areas for the ribs. It's the thoracic vertebra that have rib connections. The cervical and lumbar vertebra does not have those connections. The lumbar transverse processes are thin. They kind of go straight out to the side. All right, they're definitely different. So I don't know if I can, as you can see here, the transverse process, the spinous process on the thoracic vertebra points downwards. So please know that. All right, so please know the differences between the cervical, the thoracic, and the lumbar vertebra. Okay, and this is a wonderful PowerPoint right here that gives you a really good idea of the differences. Okay, in between the vertebra, when the vertebrae articulate with each other, they create an intervertebral foramen. Between the vertebra, there's a hole. That's what that means. A foramen means hole. And this hole, this intervertebral foramen, which is located right here and right here, is a passageway for the spinal nerves. See, the spinal cord comes down here, goes down through the foramen, but then the nerves come out the side here so that they can go out to the arms and the legs. So the most important job of the intervertebral foramen, and this could be a question, is that it is a passageway for spinal nerves. It is a passageway for the spinal nerves. Now, remember those intervertebral discs that we spoke about? Again, they consist of the nucleus pulposus and the annulus fibrosus. I want you to know what their functions are. And here it is. They bind the vertebrae together. As you can see here, here's the intervertebral disc between the vertebrae of L1 and L2. They are, again, shock absorbers. All right, they're shock absorbers. So it helps with dissipating shock and force. These discs help support the weight of the body. Now, there are bad things that can occur to these discs, and you've heard them known as herniated discs. And basically, it's when the nucleus pulposus leaves the center area and bursts out, and it puts a lot of pressure on the spinal nerves that come out from the intervertebral foramen. So again, I need you to know all of this information here. Important information that you're going to need to know. So let's go over the specific vertebra that I do need you to know. C1 is the atlas. It's the cervical vertebra, number 1. Atlas held the world up. Well, atlas supports the head. You'll know atlas because it has no body. Every other vertebra has a body. C1 does not. The job of C1, again, is to hold the head of the body up, but something that I do want you to know, it allows the motion of the skull in the gesture of yes. So it allows a cervical flexion. All right. C1 allows for cervical flexion. Again, that can be a question that I can ask on my quizzes. C2 is known as axis. All right. C2 is known as axis. C2 allows for the gesture of no, allows for cervical rotation. Now you will know C2 because there is a very specific structure that is only found on C2. This structure is known as the dens. You can also call it the odontoid process. Whatever is easier for you, I don't care. The dens or the odontoid process is only found on C2, on the axis. So again, C1 allows for yes, C2 allows for no. It doesn't want to clear. All right. Here we go. So here is the C1 and C2 and how they articulate with each other. As you can see, there is a transverse ligament that helps keep the vertebrae together. All right. You can see the dens there on the top, the axis and the atlas there. We'll go through each of the vertebra and then we'll go through the muscles that attach to the vertebra in a second. So the typical cervical vertebra, the characteristics that you will see, C1 through C7, they're the smallest and lightest vertebra. From C2 through C6, there is a bifid spinous process. So again, as you can see in the picture here to the left, here's the spinous process. It has two parts to it. And when you guys get on campus, you will see that these vertebrae in the bone box, they have the bifid look. The cervical vertebra, other than C1, has a very small body. The transverse process has transverse foramen that allows for the arteries and veins to go up to the brain. And finally, C7 is known as vertebra prominence. It's because the spinous process at C7 can actually be felt and palpated quite easily. So please know that C7 is known as vertebra prominence. It's a prominent bump in the cervical area, and it gives us a convenient landmark for counting where we are in the vertebra. The typical thoracic vertebra, there are 12. The spinous process is pointed and angled downward. The body of the thoracic vertebra is bigger than the cervical, but smaller than the thoracic. Remember, this is the only vertebra between the cervical, thoracic, and lumbar. The thoracic is the only vertebra that have attachments for ribs. All right, and you'll see those areas for attachment right here. They're called costal facets. Remember, the word costal means ribs. Okay, so it is the thoracic vertebra that has these costal facets. So it's the thoracic vertebra that connect to the ribs itself. The lumbar vertebra, the body on the lumbar vertebra are quite large, all right? Much larger than thoracic and much larger than the cervical. The spinous processes are very short and thick, okay? And the articular facets are kind of angled to allow for movement. The transverse processes, the ones that go out laterally, are also shorter. All right, so let me go through the parts of the vertebra that has muscle origins and insertions. Let's see what we got here. Give me one sec. All right, now the spinous processes. Remember, the latissimus dorsi is on the lower part of the back, on the lumbar area. The lower trapezius has its insertions on T6 through T12. The rhomboid muscle, remember, the rhomboids come off of the spinous processes and inserts into the medial border of the scapula. And the middle trapezius, remember, rhomboids and middle trapezius both do retraction of the scapula. They too come off of the C7 to T5 area, and the middle trap inserts onto the acromion process. Okay, so this, from the spinous processes, we have latissimus, lower and middle trap, and the rhomboids. The sternum, tibia. Now, from the transverse processes, we have the iliopsoas. The iliopsoas comes from the lumbar vertebra, as it's, so that's the part of the iliopsoas. The psoas major comes from the lumbar vertebra. In the thoracic area, the levator scapula from C1 through C4, the levator scapula comes down from the transverse processes and attaches into the superior angle. The quadratus lumborum, remember there's that muscle, that's the hip hiker muscle. Well, it has its insertion onto the transverse process. And finally, in the neck, we have those scalenes, those three little muscles. They too come from the transverse processes. Now, from the lumbar vertebra, again, we have the latissimus dorsi when we're talking about the lower portion. And we also have the diaphragm. Remember, the muscle that helps in inspiration also comes from the vertebra itself. So those are the muscles that come from the vertebra. All right, they come from the vertebra themselves. All right, so for the sacrum, you're going to need to know for the competence, for the practical, what the sacrum looks like. So as you can see this picture, the bone will be looking just like that. All you'll have to tell me is it's the sacrum. The parts of the sacrum that I'm going to need you to know is, I'm going to need you to know the top of the sacrum. This area right here is known as the sacral promontory. I'm going to need you to know the sacral promontory. I'm also going to need you to know the difference between the anterior sacrum and the posterior sacrum. The anterior sacrum is what you're looking at here. This area right here is a very, very smooth area on the anterior side, okay? Very smooth area on the anterior sacrum. On the posterior sacrum, as you can see, it's very, very rough, all right? You can see right in the middle there, there's like a line of bumps there. So the anterior sacrum has a very smooth portion, and the posterior sacrum has a rough portion. Now, on the sacrum, there are a couple of muscles that come from the sacrum. The first muscle is one of those lateral rotators. Remember the lateral rotators we spoke about yesterday. We spoke about the ones that you're really not going to need to know, like the gemelli sisters and the obturators, and but most importantly, the piriformis. All right, the piriformis, I need you to know, has its origin on the anterior side of the sacrum. It goes from the anterior side of the sacrum to the greater trochanter, and its main job is to perform lateral rotation of the hip. Another muscle that comes from the sacrum is that large expansive muscle that we spoke about, known as latissimus dorsi. So I definitely need you to know those two muscles come from the sacrum. Let me just check real fast. Okay. The coccyx are the small vertebra at the bottom of the sacrum. These are these bones right here. All right. So what I would do is I would make an arrow pointing to those little small bones, and I would want you to give me the name of them, and it is coccyx, Coccyx. They are the 4 bones at the bottom. I'm not worried about the information. It is a frequently fractured bone, all right, because people fall on it kind of hard. And it's an attachment point for many of the muscles of the pelvic floor, which we're not really going to go over. The thoracic cage, all right, these consist of the sternum and the ribs. The thoracic cage is basically an area of protection that protects the hearts and protects the lungs, and protects many structures within the body itself. Okay. Now, the sternum is a place for muscle attachment, which we will go over in a second. But remember, I need you to know the parts of the sternum. All right, remember the sternum is divided into 3 sections. Okay, the manubrium is the top section. The manubrium has a couple of parts that you need to know. The center part of the manubrium is known as the jugular notch. On both sides of the manubrium, we have clavicular notches where the clavicles attach to. Between the body and the sternum, there is an actual line there, and that line is known as the sternal angle. That's where the body joins the manubrium. I need you to know what the sternal angle is. The body is the longest part of the sternum, and it's on the body where many of the ribs are attached to. And at the bottom is the xiphoid process. All right, that's the inferior end of the sternum, and that's where many muscles also attach to there. So let's talk about the xiphoid process first. The muscles that attach to the xiphoid process is the diaphragm. Remember, the diaphragm is the muscle of inspiration. And the xiphoid process is where the diaphragm has its origin. The other muscle is the very large rectus abdominis. The rectus abdominis, remember, comes from the pubic symphysis as an origin and comes all the way up, and its insertion is actually into the xiphoid process. Now, the sternum itself also has muscular attachments. Remember that the pec major, pectoralis major, has its origin all along the body of the sternum. And the other muscle is the sternocleidomastoid. Again, sterno is in the name. Sternocleidomastoid comes from the manubrium section of the sternum and attaches to the manubrium and the skull on the temporal side. So you will need to know the sternum, right, and all the muscles that attach to them. Know the parts of the sternum, the manubrium, the body, and the xiphoid process. The ribs, all I'm going to need you to know is what a rib looks like, but we do have many, many muscles that attach to the ribs, and we're going to go over them. All right, there are many. What I will need you to know, I will need you to know the true ribs, the false ribs, and the floating ribs. Okay? The true ribs are ribs 1 through 7. And these ribs have their own attachment point to the sternum. They connect to the sternum independently. Those are the true ribs, 1 through 7. We have false ribs. The false ribs are ribs 8 through 10, and they basically have one attachment for the 3 ribs. Right down here, there's one attachment for these 3 ribs, 1, 2, and 3. They attach right here together. So 1 through 7 are the true ribs, 8 through 10 are the false ribs, and then finally, on the bottom here, we have 11 and 12, these 2 right here. These are known as floating ribs, and these floating ribs do not attach to the sternum. So again, 1 through 7 are our true ribs. They attach independently to the sternum. 1 attaches to the sternum, 2, 3, 4, 5, 6, and 7 attaches to the sternum. Ribs 8 through 10 are known as the false ribs because there's only one attachment for ribs 8, 9, and 10. And finally, we have the floating ribs, which are 11 and 12, which have no connection to the sternum. All right, their only connection is to the vertebra. So very important to know that. Yeah, no picture of the rib. All right, so let me go to the muscles on the ribs. So remember, we have our internal and external obliques come from the ribs. Latissimus dorsi comes from the lower 4 ribs. Pectoralis minor, the deep muscle to major, comes from ribs 3 through 5. The rectus abdominis has an insertion also on the xiphoid process, but also on ribs 5 through 7. The scalenes, the muscles next to the sternocleidomastoid, has an insertion on ribs 1 and 2. Remember the serratus anterior, that muscle right over here actually has its origin on ribs 1 through 9. And then it goes anteriorly and inserts onto the medial border of the scapula. So serratus anterior. And remember, the serratus anterior has an innervation of the long thoracic. Remember SALT, serratus anterior, long thoracic nerve. The diaphragm has an origin on ribs 6 through 12. In between the ribs, there's those intercostals between the ribs. Well, the internal and external intercostals come from the ribs. And finally, the most important core muscle of the abdominal area, the transverse abdominis, has its origin on ribs 6 through 12. So the ribs are a very, very important point of attachment for many, many, many muscles. The pectoral girdle supports the arms. Remember, we have the clavicle that attaches to the sternum. That creates the sternoclavicular joint. And then the other part of the clavicle articulates with the acromion, creating the acromioclavicular joint. And there are many, many muscles that attach in this area. The scapula articulates with the humerus bone, all right? The humerus, the long arm bone, and that creates the glenohumeral joint. Okay, so let's go through this area, and there's going to be a lot of muscles that we're going to hit here. Now, the clavicle, again, we have a sternal end, which articulates with the sternum, known as the sternoclavicular joint. And we have the acromial end, which is a flat-looking part of the bone. And you'll be able to notice it, all right, the difference. The sternal end is round and has a little mini fossa in there. The acromion end is flat, like a plane. And the acromial end articulates with the acromion, creating the acromioclavicular joint. Again, this is a bone that is frequently fractured. It is the most frequently fractured bone in the body. Now, some of the muscles that come from the clavicle, the anterior deltoid. The origin of the anterior deltoid comes from the clavicle. The pectoralis major. Remember, part of the pectoralis major comes from the sternum and the clavicle. So the pectoralis major has an origin at the clavicle. The sternocleidomastoid. So the sternum and the clavicle, and goes to the mastoid process. The SCM has an origin on the clavicle. And finally, the upper trapezius has an origin on the clavicle. I'm sorry, has an insertion on the clavicle. Remember earlier, sorry, my mistake there. Remember earlier we spoke about the external occipital protuberance is the origin of the upper trap. Well, the lateral 1/3 of the clavicle is the insertion of the upper trapezius. So the clavicle has a lot of muscles on this very small bone: anterior delt, pec major, sternocleidomastoid, and the upper trapezius. Now the scapula has a lot of a lot of muscles that connect to this area. All right, this is a very, very important bone in the body. It is a bone that we as PTAs work a lot with, and we work with a lot of the muscles in this area. So this is an area you're really going to need to know. Okay, an area you're really going to need to know. Again, the scapula, it's named because its resemblance to a spade, the digging tool. it has three sides. It has a superior side, a medial side next to the vertebra, and a lateral side next near the humerus. There really only are two angles, the superior angle and the inferior angle. They call the lateral angle because it of the angle between the glenoid fossa and the humerus. I don't think you really need to know that, but the superior and inferior angle you definitely do need to know. On the superior side, there's a suprascapular notch, which is a passageway for the nerve. It's a very small cutout. On the posterior side of the scapula, there is the spine of the scapula. The spine of the scapula starts medially near the medial border. It goes across, it goes laterally across, and the end of the spine of the scapula is actually the acromion process. On the posterior side, the spine of the scapula splits up the posterior portion of the bone into a supraspinous fossa above the spine and an infraspinous fossa below the spine. On the anterior portion of the scapula, we have the subscapular fossa. Remember, these three fossas have muscles in those, and it sounds just like the fossa: supraspinatus, infraspinatus, and subscapularis. We'll talk about it when we get there. The lateral, this lateral angle is made up of the acromion, the coracoid process, and the glenoid cavity. Again, I will not ask about the lateral angle. I will ask about the superior and inferior angle, though. And so again, here's the picture of the scapula. If we look on the left-hand side, we're looking at an anterior view of the scapula. All right. As you can see, the large flat portion in the middle here is the subscapular fossa. What I'm going to do is I'm going to start from this side here. This is the medial border. So if you can just picture, the vertebra goes down the back this way, and it's the medial border that is very close to the vertebra. As we go up the scapula here is the superior border. All right, the superior border or the superior angle. Right here is a notch. You can see it also right here. This is the suprascapular notch. This area right here is the acromion process. It's actually coming off of the spine right in this area here also. So the acromion comes off of the spine of the scapula. On the anterior portion, there's this finger-like projection. That is the coracoid process. Remember, that's where, we'll talk about it also, that's where the short head of the biceps comes from, pec minor, and also coracobrachialis. The glenoid fossa, the area where the humeral head articulates with, is right there on the lateral side. Here is the lateral border right here, and here is the inferior angle right there. Looking at from the posterior view, well, here's the spine of the scapula again, splitting up the back. Right here is the supraspinous fossa, and right here is the infraspinous fossa. We go from the top, we have the superior angle. Here is the medial border again, and here is the inferior angle. Right here is the lateral border, and we have a lot of muscles coming from there. So I'm going to go through all of these parts and what muscles come off of them. So the acromion process. From the acromion process, we have the middle deltoid coming from there, and we have the middle trapezius inserting in there. So the middle delt has its origin and the middle trapezius has its insertion on the acromion process. Go down this here. The coracoid process has three very important muscles coming from them. The short head of the biceps, brachii, has its origin on the coracoid process. We'll talk about in a few minutes that the long head has its origin on the supraglenoid tubercle, which is an area above, right here, above the glenoid fossa. Remember, there is also another muscle that comes from the infraglenoid tubercle. It's the triceps. And right here is the biceps. Okay? From the coracoid process, the bicep, short head of the biceps, the coracobrachialis. The name is telling you everything about the muscle. Its origin is on the coracoid process, and it inserts onto the brachialis, onto the brachii bone, the humerus. Coracobrachialis. Pec minor has its insertion on the coracoid process. Remember, the origin of pec minor comes from ribs 3 through 5. Right? Let's see what we got here. We got more parts to it, so I'm just trying to go through all of these parts, make sure I hit them all. Now, like I said, the infraglenoid tubercle, which is infra, again, meaning below, the glenoid, meaning the glenoid fossa, and there is a little bony area known as a tubercle. The infraglenoid tubercle has the triceps brachii, the triceps brachii. Remember, on the posterior section, the spine of the scapula splits the posterior part into a superior and inferior, into a supraspinous fossa and an infraspinous fossa. Well, the infraspinous fossa, that's where the infraspinatus muscle lies. That is where the infraspinatus muscle lies. Okay. The medial border of the scapula, has the rhomboids. Remember, the rhomboids come from the transverse process, goes to the medial border of the scapula, and also the serratus anterior, coming from ribs 1 through 9. It moves around and articulates with the medial border, the serratus anterior. The spine of the scapula has muscles. The lower trapezius, remember, the lower trapezius goes from T12 up to the spine of the scapula. And the posterior deltoid, all right, the muscle that does extension of the shoulder and the muscle that does horizontal abduction, comes from the spine of the scapula. The superior angle, this area up here. Remember, there's a muscle that's coming from above that comes down from the cervical vertebra and helps lift the shoulders like that, or elevate the shoulders. That muscle is the levator scapulae, the levator scapula. That inserts into the superior angle. Like I said, the spine of the scapula splits the posterior portion of the scapula into 2 fossa. Well, we spoke about the infraspinous fossa, where the infraspinatus muscle is. Well, the supraspinous fossa, which is above the spine, has the supraspinatus muscle. On the anterior side, we have the subscapular fossa. And the subscapular fossa has the subscapularis muscle. Sounds familiar. We talked about supraspinatus and infraspinatus and subscapularis. Those are the rotator cuff muscles that we spoke about. And teres minor we'll talk about in a second. Remember, we spoke about the tubercles coming from the glenoid fossa. We have a supraglenoid tubercle, and the supraglenoid tubercle has an origin for the long head of the biceps brachii. Remember, the short head of the biceps brachii comes off of the coracoid process. A second here. I know we got more. The inferior angle of the scapula. All right, so the bottom of the scapula. Well, it has some interesting muscles there. It has, remember, the latissimus dorsi has origins at the sacrum, at the lower four ribs. But it also has an origin at the inferior angle of the scapula. The other muscle that comes from the inferior angle is the teres major. Remember, teres major is below the teres minor on the lateral border. Okay? So teres major comes from the lateral border too. So the inferior angle is latissimus and the teres major. Coming off of the lateral border, we have teres minor and teres major. Remember, they both have different insertions. Teres minor is the fourth of the rotator cuff muscles. Remember, sits, supraspinatus, infraspinatus, teres minor, and subscapularis. Teres minor inserts into the greater tubercle, which we'll talk about in a few seconds, of the humerus. Okay? Those three muscles, supraspinatus, infraspinatus, and teres minor, are on the greater tubercle of the humerus. Teres major, though, inserts onto the lesser tubercle of the humerus. And that's all the muscles on the scapula itself. All right, so let's go to the next bone. Let me clear. Excuse me. Now, the upper limb has many, many bones and, again, many muscles. Let's remember some of the verbiage. The brachium. The brachium extends from the shoulder to the elbow. The brachium is the humerus. Remember, I said coracobrachialis. Brachium. Coraco, the coracoid process, to the brachium, which is the humerus. The antebrachium is the area between the elbow and the wrist. That's where the radius and the ulna bones sit. The carpus, that is the carpal bones, or the wrist bones. Remember when we talked about those muscles that only go to the carpals or metacarpals, flexor carpi ulnaris and things like that. And you'll hear the word manus as hand. Okay, that's where the metacarpals and the phalanges basically are. So the humerus, that is the bone that articulates with the glenoid fossa proximally, allows for the great deal of shoulder motion. All the things that you're going to need to know about this bone are on this slide. The proximal end has the humeral head. Okay? That humeral head articulates with the glenoid cavity of the scapula, creating the glenohumeral joint. Hold on one second. Can I stop it? Can I stop it? Oh, there we go. One sec.